Hi, my name is Dr. Aashish Contractor. I am the head of the Department of Cardiac Health and Rehabilitation at the Asian Heart Institute, and I've been with the Asian Heart Institute since its inception in the year 2002. I am also the medical director of the Standard Chartered Mumbai Marathon, and the Asian Heart Institute has been the medical partner of the marathon since its inception in the year 2004.
Doctor, you have been involved with the Standard Chartered Marathon for several years now. Is running good for the heart? How? And what about people who already have heart disease? Do they participate too?
Well, running is certainly good for the heart. Let me take a step back and say exercise is good for the heart, and running is one form of exercise. So if somebody has not been exercising regularly, I would say start by walking. Once you can walk at least for 30 to 40 minutes without a break and without getting too tired, then you can take up running. So both walking and running have direct and indirect effects which protect the heart. In terms of indirect, they tend to control most of the risk factors. So regular exercise helps control your sugar, your blood pressure, your cholesterol, your weight. It's also a great way to reduce your stress. So by reducing all these factors, your risk of heart disease goes down. Besides these indirect mechanisms, there are direct mechanisms. So as you exercise, you literally train your heart to become, in a manner of speaking, stronger. It helps pump the blood more efficiently. A person who exercises regularly, their heart is less prone to having abnormal heart rhythms. In times of stress, the heart is better able to cope with it when you're a person who exercises regularly. Certain hormones are secreted within control when you're regular exercisers, which also go towards making the heart beat very fast. So those are controlled once you exercise regularly. And exercise also makes your blood less sticky, and that helps to prevent the blood clotting and the heart attack as well. So exercise really is the best and the cheapest and safest medicine that you have for your heart. Actually, since the time the marathon has been launched in Mumbai in 2004, our heart disease patients at the Asian Heart Institute who have been participating in the cardiac health and rehabilitation program, they've been taking part in large numbers. So for example, for the last 4 to 5 years, we've had about 70 of our patients taking part in the Dream Run, about 15 of them taking part in the half marathon, which is 21 kilometers, and 1 or 2 taking part in the full marathon, which is 42 kilometers. However, it's important to remember that they just don't wake up one fine day and decide to go and take part in the marathon. After they've had their heart disease or their surgery and they've recovered, we are monitoring them very closely. We start them in the cardiac rehabilitation program, taking baby steps. So the first day they come in, they may literally walk just for 5 minutes and then progress to 7 and 10, and then we keep progressing it while monitoring the heart. So when done correctly, and that's a very important point, when done correctly and in the right person, a person with heart disease can certainly take part in the marathon.
For more on your health, log on to health.india.com.